Warning to women with type 2 diabetes who take HRT tablets, as study discovers link to blood clots and heart disease. Women with type 2 diabetes should consider switching their HRT tablets to patches to reduce their risk of potentially fatal blood clots, according to a new study. Researchers have found women with the condition who take an oral form of HRT have double the risk of a pulmonary embolism when a blood clot blocks an artery in the lung than those using skin patches. They also have a 21% increased risk of heart disease, the study revealed. And the scientists said their findings should be seriously considered by women and their doctors when deciding what form of hormone replacement therapy to take. HRT is regularly prescribed to women suffering from the effects of menopause to relieve symptoms such as hot flushes and night sweats. Treatments include tablets containing estrogen only or a combination of estrogen and progesterone, as well as patches, gels, and creams. Between 2023 and 2024, approximately 2.6 million women in the UK were taking some form of HRT. A team, led by researchers from the University of Liverpool, analyzed data obtained from the electronic health records of more than 36,000 women on HRT who were followed for 5 years. Women with type 2 diabetes who are currently taking HRT tablets should consider switching to patches. Experts said they found a significantly higher risk of pulmonary embolism and heart disease for women with type 2 diabetes who took HRT in tablet form compared to those who used skin patches.
Given increased risks with oral HRT, we propose that women with type 2 diabetes should not be prescribed oral estrogen therapy.
The authors suggest that the reason for the difference in risk of developing pulmonary embolism and heart disease between oral and transdermal HRT might be due to the different way estrogen is absorbed. When taken orally, much of the estrogen is broken down by the liver before entering the circulation, which might impair the balance between clotting and anti-clotting proteins. In contrast, when given in patch form, estrogen is given in lower doses and absorbed directly through the skin and into the blood circulation. Despite the increased risk in pulmonary embolism and heart disease, there was no difference in risk for deep vein thrombosis, DVT, stroke, or breast, ovarian, or endometrial cancer between the two HRT methods.
The decision to use HRT, even for a short period of time, is very difficult for many women.
We hope our data will provide the increasing number of postmenopausal women living with T2D and their physicians with more evidence to consider when weighing the risks versus benefits of the most appropriate HRT formulation. The findings were presented at the annual meeting of the European Association for the Study of Diabetes in Vienna. Menopause explained. The menopause occurs when a woman stops having periods and can no longer fall pregnant naturally. It is a natural part of aging, which occurs in women between 45 and 55 years old. However, 1 in 100 women can experience menopause before the age of 40, which is known as premature menopause or premature ovarian insufficiency. Symptoms often include hot flushes, night sweats, low mood, reduced sex drive, vaginal dryness, an increase in facial hair, and difficulty sleeping. According to NHS advice, symptoms can begin months or even years before your periods stop and last around 4 years after your last period. Premature or early menopause can occur at any age, and in many cases there's no clear cause. Source: NHS. Share or comment on this article. Warning to women with type 2 diabetes who take HRT tablets, as study discovers link to blood clots and heart disease.